John, a 28-year-old man who used heroin, adultered with Xylazine. This is how his skin crashes. John's descent into addiction began with a single decision as he sought solace in the fleeting escape of heroin. Unbeknownst to him, his refuge was tainted with Xylazine, a tranquilizer meant for animals, now adulterating the powder he craved. As days blurred into nights, John's body bore the marks of his poison, with lesions emerging as silent alarms signaling the turmoil beneath his skin. Initially dismissed as mere irritations, the sores evolved into open wounds that refused to heal, becoming more pronounced and painful with each passing day. Trapped in the vicious cycle of addiction, John found himself powerless to seek help, with the cost of medical care an insurmountable barrier. The skin lesions that marred John's body transformed from small red patches into angry raised welts, creating islands of agony on his once unblemished skin. The texture varied, some smooth, others rough and scaly. The centers of the larger wounds broke down into open ulcers, oozing a clear, sometimes yellowish fluid and surrounded by a halo of reddened, swollen skin. Pain was a constant companion, ranging from a dull ache to sharp, stabbing sensations. The slightest touch exacerbated the discomfort, making even simple movements a torment. As the lesions worsened, they became breeding grounds for infection, with the edges turning darker and the discharge thickening. Despite his growing alarm, John's fear of withdrawal and lack of resources kept him from seeking medical attention. The lesions, once mere signs of his addiction, now served as stark symbols of his descent into a world where pain and suffering were constant companions, and relief seemed like a distant dream. On a day that started like any other in John's turbulent life, his relentless pursuit of escape led him to a dire crossroads. Unbeknownst to him, the dose of heroin he injected was laced with a potent amount of Xylazine, setting the stage for a life-threatening overdose. As the drugs coursed through his veins, John's body began to betray him in alarming ways. John's friend found him in a state of profound sedation, barely responsive to any stimuli. His breathing was shallow and labored, a telltale sign of respiratory depression induced by the toxic cocktail in his system. His pulse was slow and thready, and his skin felt cold to the touch, indicating bradycardia and hypotension. The pinpoint pupils in his eyes, a characteristic sign of opioid intoxication, were also present, but the overall picture was more sinister, hinting at the presence of Xylazine. Recognizing the gravity of the situation, John's friend rushed him to the emergency room, where the medical team sprang into action, piecing together the clues of his condition. Upon arrival, the doctors prioritized securing John's airway and breathing. He was placed on supplemental oxygen, and preparations were made for possible intubation if his respiratory status worsened. Intravenous fluids were started to counteract the hypotension and support his circulation. Naloxone, the antidote for opioid overdose, was administered, but its effect was limited, confirming the suspicion of Xylazine co-intoxication. The medical team then focused on symptomatic management, closely monitoring John's vital signs and providing supportive care to stabilize his condition. As John's body fought the dual onslaught of heroin and Xylazine, the medical team worked tirelessly to address the symptoms of the overdose. They employed vasopressors to combat the persistent hypotension and used medications to manage the bradycardia. The skin lesions, a stark reminder of his chronic Xylazine use, were cleaned and dressed to prevent further infection. Throughout the ordeal, John's friend stayed by his side, a silent witness to the devastating consequences of addiction and the thin line between seeking solace and finding oneself on the brink of death. The experience served as a sobering reminder of the dangers lurking in the shadows of the opioid crisis, where substances like Xylazine add a deadly dimension to an already perilous landscape. After several days of hospitalization, as John's condition stabilized from the immediate threat of overdose, the focus of his medical team shifted to the alarming complications arising from his skin lesions. The once superficial sores had transformed into a labyrinth of deep necrotic ulcers, revealing the insidious nature of Xylazine's impact on his body. Upon closer examination, the doctors observed that the lesions had become breeding grounds for many bacterial infections. The once clear discharge had turned into a thick, purulent fluid, signaling the presence of severe infection. Some ulcers showed signs of cellulitis, with the surrounding skin becoming red, swollen, and tender to the touch. The most concerning finding, however, was the suspicion of osteomyelitis in a few lesions where the infection appeared to have penetrated down to the bone. Treatment of complications. The medical team initiated a multifaceted approach to address these complications. John was started on broad-spectrum intravenous antibiotics to combat the bacterial infections. The regimen was later adjusted based on the results of wound cultures to target the specific pathogens identified. Some deeper ulcers require surgical debridement to remove dead and infected tissue and promote healing. This procedure was crucial in preventing the spread of infection and preparing the wounds for further treatment. The wounds were meticulously cleaned and dressed regularly to keep them sterile. Specialized wound care techniques, such as negative pressure wound therapy, were employed to encourage healing and reduce the risk of further infection. Given the significant pain associated with these lesions, John was provided with appropriate pain relief measures to ensure his comfort during the healing process. Recognizing the importance of nutrition in wound healing, the medical team ensured that John received a diet rich in proteins, vitamins, and minerals to support tissue repair. As the wounds began to heal, John was introduced to physical therapy to maintain mobility and prevent muscle atrophy due to prolonged bed rest. Throughout this ordeal, the medical team remained vigilant for any signs of complications, ready to adapt their approach as necessary. As John began to exhibit signs of xylazine withdrawal, the medical team promptly initiated a treatment regimen to manage his symptoms and ease his discomfort. They administered dexmedetomidine to help reduce his agitation and provide sedation without the risk of respiratory depression. Tizanidine was used to address the muscle spasms and tension that accompanied his withdrawal, while phenobarbital was employed to mitigate the risk of seizures, a potential complication of abrupt cessation of xylazine use. As John's condition stabilized and the acute phase of withdrawal subsided, the medical team transitioned him to clonidine. This medication helped manage his hypertension and tachycardia, providing a smoother and more controlled reduction in his withdrawal symptoms. Throughout this process, the medical team closely monitored John's response to the treatment, making adjustments as necessary to ensure his safety and comfort. The careful management of his xylazine withdrawal was a crucial step in his journey toward recovery, allowing him to focus on healing both physically and mentally from the ravages of addiction. In light of the increasing reports of xylazine-related overdose deaths and its association with severe necrotic skin ulcerations, it's crucial to understand the complexities of xylazine toxicity and its management. Xylazine, a synthetic substance approved for veterinary use, has found its way into the human drug market, primarily as an adulterant in illicit opioids such as heroin and fentanyl. This combination significantly increases the risk of fatal overdose due to augmented sedation and respiratory depression effects. Xylazine toxicity presentation. Xylazine acts as an alpha-2 agonist similar to clonidine, leading to decreased vascular tone and heart rate. The clinical presentation of xylazine toxicity includes respiratory depression, bradycardia, meiosis, hypotension, and CNS depression. Chronic use of xylazine can result in skin changes ranging from superficial ulcerations to severe soft tissue destruction, often complicated by superimposed infections. These skin changes are believed to be secondary to xylazine's vasoconstricting properties on local blood vessels, resulting in decreased skin perfusion and impaired wound healing. Treatment of xylazine toxicity primarily involves supportive care, including IV fluids and mechanical ventilation for severe respiratory depression. Naloxone, the standard antidote for opioid overdose, is ineffective in reversing xylazine's effects. Therefore, in cases of minimal response to naloxone, xylazine toxicity should be suspected for patients with skin changes, topical wound care, evaluation of deep tissue infections, and possible admission for IV antibiotics and surgical debridement are necessary. Managing xylazine withdrawal is challenging due to the lack of well-defined protocols. However, there are case reports of using dexmedetomidine, tizanidine, and phenobarbital, followed by a transition to clonidine, to manage withdrawal symptoms such as dysphoria, agitation, hypertension, tachycardia, and diaphoresis. To wrap up, the emergence of xylazine as an adulterant in illicit opioids presents a significant public health challenge. The unique toxicological profile of xylazine, characterized by its sedative, analgesic, and muscle relaxant effects, necessitates a tailored approach to the management of overdose and withdrawal. Healthcare professionals must be vigilant in recognizing the signs of xylazine toxicity and co-intoxication, especially in the context of the opioid crisis. Further research and clinical guidelines are needed to understand better and address the implications of xylazine abuse in humans. Thanks for watching. Take care.